clean my hands.
Hi, my name is Kayla Gordon. I'm in Professor Lord's Adult Health 1 Term 2 class. I'm going to be doing the NG tube insertion and irrigation. First, I'm going to go ahead and check with my MAR and my physician's order, seeing that I need a 14 fringe NG tube for low intermittent suctioning. First, I'm going to make sure that I get an NG tube that's 14 fringe, like the doctor ordered. I'm going to get a 60 milliliter syringe with water, a cup for ice for the patient, lube, a pen light, tape, and a rubber band with a safety pin. I'm going to go ahead and get a couple pieces of tape ready for when we go into the patient's room.
Swelling, redness, allergic reaction, shortness of breath.
Don't look at the paper.
Alright, I know I'm trying to get in my mind.
I'm going to do a Y on this one.
Or, any anaphylactic reaction, go ahead and let us know.
Now I'm going to go ahead and go into the patient's room.
Go ahead and hang this.
Hi, my name is Kayla. I'm going to be your student nurse today. Can you go ahead and tell me your name and your date of birth?
Kelly Jackson, 9/12/88.
Thank you. I'm just going to check that with your bracelet and also again with my MAR. According to my physician's order and my MAR, you're going to be getting a 14-inch fringe NG tube today for low intermittent suctioning. Have you ever had a NG tube before?
No.
Alright, well, it's a tube that's going to go down your nose, through your esophagus, and down to your stomach to suction out some of the stuff that the doctor wants to be able to see and whatnot. So first I'm going to make sure that you are in high Fowler's, which you are. Next I'm going to go ahead and assess the patency of your nares and your oral cavity. I see that this nair on this side has a deviated septum, so we're going to use the nair on this side. Next I'm going to go ahead and ask if you have any allergies to lube.
No.
Good. Okay, so next I'm going to go ahead and open my NG tubing. I'm going to go ahead and wash my hands first though, before I touch your tube. I'm going to open it up and measure the tube along from your nose to around your ear down to the xiphoid process. And it ends at 60. So that's where we're going to mark it. I'm going to go ahead and place this back on the clean paper and wash my hands once more. Apply clean gloves.
Let's begin. Alright, I'm going to go ahead and verify the MAR.
And place a towel on the patient's chest.
The doctor has ordered 100 milligrams of acetylene.
Right. Next, I'm going to go ahead and tell the patient that we're about to insert the tube. So lean your head back. And I'm going to make sure I put lube on the tube a few inches so that it slides through. I'm going to take this and insert it into my chosen nair and advance it in just slightly.
His date of birth.
Okay, take my pen light to see if it's coiling in the mouth, which it's not. So now I'm going to have the patient put their chin to their chest, and we're going to advance it more. If the patient was to start gagging or having any issues, we would retract it. I would give him a sip of water and let him rest. But now we're just going to have him swallow, and we're going to insert it the rest of the way. Since once we get it at my mark, I'm going to go ahead and temporarily place a piece of tape right here until we make sure that it's in the correct place. And then I'm going to go ahead and take my pump and attach it to my NG tubing. I'm first going to ask to see if the patient can talk. Can you say hello?
Hello.
That's good. I'm going to go ahead and take my pump, attach it to my tubing, and aspirate 30 milliliters. I see
Already labeled
that
this.
the stomach contents
Verify my
is a
bar.
greenish color.
Here's my
According to
dosage
hospital
count.
protocol,
Good,
we're going
we
to
do
check the
50,
pH
it's
to
gonna
a
be 50
Lichtman
ml bag
paper
over 30 minutes.
and
We
see what
drop
the
it in a pen.
consistency is.
Do
We
the
also
70
know that
drops.
whatever comes out must come back in. So we're gonna hold that. I'm gonna put this right here. Put my stethoscope on.
So I'm gonna go ahead and go into the room.
Listening to the
I got my
epigastric
mom.
area.
Hello, sir. How you doing? My name's Craig. I'm your nurse, student nurse today.
I'm gonna listen for a swishing sound at the epigastric area,
And we would verify the name and date of birth is correct.
which I hear.
Medication and is
So
correct.
we're
on the
gonna go
mark.
ahead
Sir, the doctor
and
said that we had a
take
little bit
this
of
tubing
infection,
off.
and your white blood cell count is elevated.
Over
It's
here.
about 15,000. He has
Next, I'm
ordered,
going to take my
100 milligrams of Rocephin
Y
to be
tape.
home, and we're going to go ahead and just
I'm gonna
attach
place
that to
this
your normal saline
on the
that's already
nose.
running, okay? Is that alright?
take the first part of the Y
And can
and
you tell
circle
me
it
if you have
around
any
the
drug
there,
allergies?
and the other
No
one
drug
around
allergies?
the other way,
Go ahead and get this ready.
making sure it stays. Take another piece of tape to stabilize the tape. Now I'll take this piece of tape off their cheek so that it's stable just on their nose. I will next take my rubber band and my safety pin,
The port.
wrap it around the tube, and pin it to the patient's shirt, having the patient turn their head the other way so that they're not looking, and it gives the tube some slack for when they're moving and sleeping. I'm then going to make sure that the patient's in a comfortable position, not in any too much pain. And the only way to make sure that the NG tube is in the correct spot is to note that it's in with an X-ray. So depending on the hospital policies,
And I'm gonna do this
other than that,
with
we're
the
going to
back one.
put the comfortable position and the NG tube is inserted.